My periods are normal. Why am I not getting pregnant? Sis, I hear you. It's reassuring to have regular periods, but if you're still not getting pregnant, there are other questions that we need to ask to help you get to the bottom of things, to help you uncover the answer to this question. The first question would be, are you actually ovulating? Yes, you can have regular periods without actually ovulating, where a period comes but an egg was not actually released, and this is called an anovulatory period. So this is something that happens and you may not even know it's happening if you're not actually tracking your ovulation. So how can you tell if you're actually ovulating? There are different methods to do this. One of the ways is to track your body temperature every morning, to keep a track, and then when ovulation happens you see higher temperatures, but that's something I can talk about in a different video. Another way would be to get ovulation prediction kits. It's like pregnancy test kits where you check and it gives you an idea of what's happening with your ovulation. Another one would be to get your blood test done 7 days after your assumed ovulation date, where your progesterone level is tested. And another one would be to um another method would be to get an ultrasound done to look at your ovary and see if an egg was actually released from any of your follicles. Okay, so that's the first question: are you actually ovulating? The second question would be, are your tubes open? So if your fallopian tubes are not open, you know obviously there's no way your husband's sperm would meet with your egg. And if you've been trying to conceive for a while and it's not happening, I think it's time to get a HSG done, a HSG test to get to check if your tubes are open. You have two tubes. If both of them are blocked, well, nothing would happen. But if you have at least one open, then you have a chance of a pregnancy. Okay. Then the third question is, has your husband had a proper semen analysis done, where his count, his sperm count, his sperm motility, and the morphology is tested? And depending on how in-depth you're going, you have to check for something called DNA fragmentation. So this is something that needs to be checked. It's not I see this a lot where women just start taking supplements, taking medications and all, and the husband has never gotten tested. So speak to your husband and get that test done, just so that if there's something that needs to be corrected, that can be corrected, then you can possibly start working on it. Because I mean, it takes 72 days for sperms to be produced, so you have about 3 months window to correct things if it's something that can be corrected in that end. Okay, and then the fourth question I'll be asking is, what is the condition of your womb? Consider your womb, your uterus, like the soil where the seed gets planted. If the seed is in the best condition and that soil is not optimal, then that seed